Hi, my name is Caitlin Courtney, and for my research paper, I chose to write the effects mirror therapy has on amputees that are suffering from phantom limb pain. In the United States, about 30 to 40,000 amputations are performed each year. An individual may need an amputation because of trauma, tumor, cancers, vascular disease, and infection. Individuals that have had an amputation are faced with many challenges in their everyday life. More than half of individuals that have had an amputation are likely to feel neuropathic pain in the limb that is no longer there. In the absent limb, amputees can feel sensations such as burning, throbbing, cutting, stabbing, sharp, and shooting pain. This neuropathic pain is known as phantom limb pain. Phantom limb pain can happen to any individual that has had an amputation of any limb in the upper or lower extremity. Our researchers stated that the prevalence of phantom limb pain is more common among amputations of the upper than lower extremity. It is also more common in females than males. Most individuals that endure phantom limb pain report pain from the distal portion of the absent limb. Symptoms of phantom limb pain can occur as soon as a few days or up to a year after amputation. There is no known cause to what leads to phantom limb pain. When an amputee is suffering from chronic pain, like phantom limb pain, it is physically and mentally draining. In the article, Kuffler mentioned how chronic pain affects an individual's potential for performing activities of daily living and instrumental activities of daily living. ADLs and IADLs are essential for a person's independence. In addition, phantom limb pain can lead to depression, decreased quality of life, and feeling of hopelessness. Since there is no known cause for phantom limb pain, finding treatment to relieve pain can be difficult. Some treatment options include medications such as antidepressants, opioids, and anticonvulsants. In addition to medication, an amputee can also use non-invasive therapy techniques to relieve phantom limb pain. These techniques include acupuncture, repetitive transcranial magnetic stimulation, transcutaneous electric nerve stimulation, spinal cord stimulation, and mirror therapy. Out of these potential non-invasive treatments, mirror therapy has shown success in decreasing pain in individuals with phantom limb pain. The idea of mirror therapy came from a researcher named Ramachandra after he had a positive experience decreasing pain from an individual with phantom limb pain over 20 years ago. In the past 20 years, this technique has become increasingly popular because of the positive effects it has had on clients. Mirror therapy uses a mirror to create a reflective illusion of the absent limb in order to trick the brain into thinking movement has occurred without pain. Mirror therapy includes placing the affected limb behind the mirror so the reflection of the intact limb appears in place of the hidden limb. Watching the reflection creates a visual illusion of movement from the amputated side. During my research, I discovered many studies that have conducted a study with amputees that have had an amputation and are currently suffering from phantom limb pain. These studies use mirror therapy to find a positive effect in decreasing pain. Researchers use pre- and post-assessments to observe the effects of mirror therapy. Some types of assessments that were used include a visual analog scale, which is when a patient grades their pain from 0 to 100. 0 being the least amount of pain and 100 being the most severe pain you've ever been in. Another assessment that is used is the McGill Pain Questionnaire. On this questionnaire, there are 78 words that describe different types of pain, and patients choose which words describe their experience of phantom limb pain. One convenient thing about mirror therapy is that patients can conduct the treatment in the comfort of their own home. Prior to practicing this intervention at home, either researchers or therapists have a one-on-one session with the patients. During this session, they show patients how to perform the exercises and the proper positioning of the mirror. In almost every study I read, patients with phantom limb pain have shown a decrease in pain by the time treatment was completed.